Hoey, Regional Manager for Fallbrook Pet Parlor, LakeLand Pet Grooming, Temecula Pet Salon, and Doggy Spa Corona. I'm also certified pet tech, first aid, and CPR instructor, and that's what we're going to do today, is CPR and first aid for pets, specifically in our grooming salons. So let's start with our intro, which is a little bit about why it's important for everyone to be well versed and trained and feel comfortable doing pet first aid and CPR. And I really think that it's the responsibility of any person claiming to be a pet professional to be as trained, capable, and knowledgeable as possible to do the best we can for the pets in our care. Pet first aid is the immediate care given to a pet that has been injured or taken suddenly ill. So the more comfortable we are with their vital signs and what's normal for a pet, the easier we're going to be able to see what's off normal for them and maybe catch an emergency in the making before it gets started. I think 60% of pet emergencies that go into the vet are preventable incidences. So if we can help out pet owners with seeing stuff coming down the road and prevent them, even better. And then also if we can be there to, mitigate a real big emergency, that's also great. One thing to keep in mind when we're talking about all this stuff is that it's very important, and it's also our company policy, that we stay within our scope of practice. So what this means is that we should not be stepping out of what our training is and what our job is and doing things like diagnosing an illness or anything, or doing treatments or procedures that we haven't been trained and certified and licensed for. So we are not veterinarians. We are not vet technicians. We haven't been trained for that. Really what we can do is observe and report, and then of course respond to emergencies in a life-saving instance, but we cannot diagnose any problem. So we can't tell clients that I think Bella has an eye infection, but we can say, I want to let you know that Bella has a very irritated eye. It's swollen and secreting green, thick liquid. It's definitely something you want to take her to see the vet about. So we can relay symptoms and signs that we see. We can't diagnose. Another thing to keep in mind is we don't want to do anything that's going to make a situation worse. We're going to go by the credo, do no harm. So if doing any portion of our service or grooming service is going to make a situation or an issue that a pet's having worse, then we're not going to do it. We're there to improve pets' lives and health and well-being and make them feel better. So we don't want to do anything that's going to make any situation for them worse. This is why we have a very strict policy of any pet with an open wound cannot get a bath, because we run the risk of putting bacteria into that wound and making it worse. So we just can't groom them that day until they've seen a vet, have that cleared up, and come back. So keep that term in mind, do no harm. If performing the service would do more harm than good, then it is not okay. And then I kind of like the little verbiage, use your head, be gentle with your hands, and have a heart. So everything we're doing is because we love the pets, but sometimes we need to slow down, take a breath, use our heads, look at everything going on around us, figure out what the best course of action is, and then of course always have gentle hands. So we're going to start with going through our pet first aid kit. One of those is going to be in every salon. If you're missing anything out of here, notify your managers so we can get it restocked immediately. And the first thing that we're going to look at in here is we do have some posters that are going to be up in your salons, somewhere where it's easy for everyone to see and access, maybe the break room. The first one we have here is the snout to tail assessment. So this is when you're going to have a few moments to go through looking over the dog nose to tail and how they're doing, and looking for any signs and symptoms or issues they may be having. You'll notice this is very, very similar to and almost exactly the same as our quality check-in steps. So when we're checking dogs in, we should be doing these steps as well, running our hands over every part of the dog and looking for these symptoms. In a moment, when we're done with the pet kit, we're going to go back and I'm going to demonstrate a snout to tail assessment and go through what you should be looking for during those. So we'll have these posted up. We also have choking management steps. This is just a good reference chart to remind you of the steps that you need to take in case of a pet choking. Notice it is broken up into for conscious pets and unconscious pets. We'll be going into depth about what you should do and what your protocols are when a pet is choking a little bit later on. The third poster we have is the primary pet assessment. So this is different from the snout to tail assessment. The snout to tail is in a non-life-threatening emergency situation when you have time to go through the entire dog. The primary pet assessment is a very quick, you should be doing this in about 12 seconds, and it's just to assess, and you're going to hear this over and over again, ABCs. This stands for airway, breathing, and circulation. These three things we have to have to sustain life within 3 minutes. So this is all this is going to do, is walk you through the steps to find out if a pet is breathing and has an open airway, and if its heart is beating. And if those three things aren't there, then we're going to jump into CPR, which of course we're going to go through in depth a little bit later on. But, in the moment things get a little nuts, you need to reference really quick. This is the steps I need to take just to keep myself on track before I jump into doing CPR. This will be up on the wall for everyone. And then we have our final poster, which is bleeding protocols. And again, we're going to go through this in depth as well further on in the class today. Also, in your pet kit, you're going to have saline solution. These are different from the eye drops that we use when bathing each and every pet. These are meant to be kept in here, and they're large bottles so that you can flush out eyes. If anything gets in their eye from a foreign object to a chemical, anything like that, you can use entire bottles to continuously flush out the eyes. So these need to be kept in your kits. You're also going to find a bag of small popsicle sticks and paint stir sticks. We're going to demonstrate what these are for later on. They're basically going to be used to splint limbs that we need to hold still for transport into a vet. And we'll go through how to do that. We're also going to have different sizes gauze in there. These are going to be to use with our bleeding protocol steps if we have a pet that's bleeding. And then of course little rolls of gauze to wrap up those wounds for bleeding protocol as well, and to use when we're splinting limbs if we need to immobilize. You're also going to find a number of the little red muzzles. These are really simple and easy to use. I'll demonstrate how to use these as a muzzle, as well as our regular grooming leads that we have in all the shops and use every day if you don't have these handy. And each one should also have a specific bleeding kit. It has in it a muzzle, some of the little rolls of gauze, and then a bigger triangular bandage that you can use to either splint up a limb to immobilize it or use for more heavy bleeding. All right, I've got my little assistant here, Franny, to help us with demonstrating how we use a couple of muzzles. So these are just nice, soft, long pieces of thick fabric, and this is a really nice way to use a muzzle because it can stay on for a while. If it's not too tight, it's more comfortable and flexible, and it's easier to transport a pet with this if we need to take them to the vet. So you're just gonna make a nice loop with your fabric about halfway through. I've got a pretty small loop for her because she's a little dog, and we're going to put that right over her nose and bring it up behind her ears and tie it at a nice little bow right there. That way, always do the bow so it's quick release, so that if something happens and you need to get them out of it right away, all we have to do is pull and she's right out of it. Easy peasy. The other type you can do, these are our leads that we have every day in the salon. And you can just take your loop, if it's already on a dog and it's over their neck like this, let me turn you this way, little friend. Then you can just take your handheld part, loop it over the nose once or twice, and you can even put it back through the neck right there. And then you have a lead that the dog's also muzzled in, and that's easy to pull right off as well really quickly. All right, I've got a new assistant here, Maisie, and we're gonna do a snout to tail assessment on her. That's literally like it sounds. We're gonna run our hands over all parts of this dog's body from her nose to her tail. And first I'm gonna look at her eyes and nose, look and see if there is any discharge, discoloration, that her eyes are equal with her pupils dilated. And also her mouth, might feel along the muzzle, any abnormalities, deformities, anything going on there. I'm also going to be able to see if her teeth are really bad at this point. If we're doing this in a non-emergency situation, it's a good way to see if they need to go to the dentist and let the pet parent know. And then of course I'm going to look inside the ears. Everything should be pink, clean, and healthy with no bad smell or discharge from the ears. And also feel along the skull and neck if there's any deformities or anything that stands out as odd, and that they have full range of motion in that neck as well. And then we'll move down into the shoulders and front legs and chest area. I like to run my hand down the entire leg, also feeling for any deformities, as well as range of motion for this pet. So at this point, if anything's hurt or broken, they'll let us know that it hurts, and they won't have range of motion. And even for pulled tendons and ligaments, they might not have good full range of motion on either one, so we're gonna note that. Also gonna check toenails, that they're not cracked or torn, and paw pads. Kind of like to run my fingers through toes and paw pads, make sure there's no foreign objects and stickers in there. And then we'll move on to our abdomen. Just gently with the pads of your fingers or the flats of your hand, just gonna gently put even pressure as we go down, feeling for any lumps, bumps, if the dog reacts in pain. And while we're there, we can also feel the rib cage area, see if anything's sticking out or abnormal in the rib cage area, or again, if they respond in pain. I always like to kind of run my 2 fingers down either side of their spine, putting a gentle pressure there, just to make sure they don't react in pain anywhere on that. And that'll lead me right into the tail, and making sure that they don't have any, a broken tail or injuries to the tail, and that there's full range of motion there. And I do kind of like to sweep my hands over genitals. There shouldn't be any swelling, redness, discharge that's colored or anything like that. And then we'll do the same thing on the back leg, feeling down to the paw pads and toenails and checking that the dog has full range of motion on that. All right, so we're into the portion where we're going to learn how to check pets' vital signs. And the first thing that we're going to talk about is checking for a pulse. So anywhere that a major artery is closer to the skin is a good place to check the pulse, but often the easiest place is the femoral artery, which runs right here at the back leg where the leg meets the groin area. So it's in this crease right in here. You can, if you have a bigger dog, run your hand from this direction. They're generally a little bit more comfortable with that than coming from the back near their genitals. She's not super comfortable with laying down for me, which is fair. You can do a pulse check while the dog is standing as well. It's a little bit harder when they're sitting, but since she's kind of letting me have her lay down, so it's a little easier to see for you. Just gonna run my fingers down her tummy, and I'm gonna find that crease right where her back leg meets the groin area. And with just the pads of my finger or fingers, I'm gonna hold it right there and wait to feel the pulse in that area. I like to count for 6 seconds and then add 0 to that, so I have a full minute or 60-second count. So let's go ahead and take her pulse. 4, 6. So that's 6 in 6 seconds. I'm going to add a 0 to that, and we're at 60 for her pulse today. Good job. All right, so it's important to know that a normal pulse rate for most dogs is between 60 and 140 beats per minute. So as demonstrated, Franny's was at 60. That's normal. And then small and toy breeds can be a little higher, so 90 to 140. And so anything over 140 might be a little bit concerning. And then cats range from 140 to 250. So double the pulse rate of dogs. So don't panic if the cat's pulse is that high. They might just be a little bit stressed out, but it's kind of normal for them to be in that range. Okay, for checking breathing and breaths per minute, same thing if you have a dog laying down or standing up or sitting. You're going to place your hand on the side of the chest. So, kind of shit house a little. But I don't. So you're just going to take your hand and slide it down behind their back leg, right, or their front leg, onto their rib and chest area right here, just behind the front leg. And just wait until you see that rise and fall of the chest and feel that, and then you're going to count that. Same kind of thing, you're going to count it for 30 seconds and then double that number. The breaths, also pay attention to the character of the breaths. They should be smooth, rhythmic, and easy. They shouldn't be labored. There shouldn't be a loud wheezing sound or what we call stridor when they're breathing in. So it's going to sound like kind of thing. That might be an obstructed airway. So you're going to look for that breathing to be relaxed. Even if they're panting, the air should be flowing smoothly in and out of their chest when you're feeling it on the chest. And then a normal breath rate for a dog is between 10 and 30 breaths per minute, and cats are going to be between 20 and 30. So again, a little bit faster for cats, but we shouldn't be over 30 unless the dog is beginning to get into a stressful situation. The next thing that we can check for vital signs is our gums and gum color. It's a pretty open mucous membrane area, so it really shows the state of that pet's health very easily for us to see. The first thing we should look for is that the gums are a little bit moist to the touch, and that we're going to do capillary refill next. I'm sorry. So we'll go through a few of the colors. The gum should be pink, like just a gentle bubble gum pink is normal for dogs. If they're yellow, we could be looking at something like a jaundice or liver disease issue, or even an immune or anemia issue. If they're bleeding or inflamed, this could be gingivitis or a dental issue. And then pale or white. If the gums are pale or white, or even sometimes going into blue, this signifies a lack of blood flow. So they could be in shock, have anemia, or just have low blood pressure. Bright and cherry red gums is not good either. This could be a sign of very high blood pressure, of heat stroke, or even in some cases of poisoning or foreign chemical in the body. So we want that bubblegum pink, not bright red or cherry pink. Blue, purple, or gray. This is called cyanosis, and it signals very, very poor circulation, as if the heart is not able to do its job and properly circulate the blood throughout the body at all, or a blood volume issue. So if this pet has lost too much blood and they don't have enough volume for the heart to do its job and pump that blood around, then you're going to see very blue, purple, or gray. And it also could be a sign of hypothermia or respiratory disease or heart disease. And then spotted or mottled gums. This is normal in some breeds that have, a mottled undertone to the skin. You might see this in chows. We've seen various mixed breeds that have kind of a mottled. So just pay attention to the parts where you can see the color that are not black, and check there for your coloring on that. And then while you're there checking the gums, another good thing to check for our vital signs list is capillary refill. So the small veins in that area are called capillary veins because they're smaller than the regular veins or arteries going the other direction. And so it's easy to see on the gums when you press gently in on the gums and hold for a second. What you're doing is stopping the blood flow from the area underneath your finger, and then you're going to release and watch how quickly those capillary veins refill and the color comes back into the area that you've pressed. So you want to see it fill back in within 2 seconds or less. It should immediately send that blood flow right back into that area. If it doesn't, we're having a blood flow issue. All right, so checking a general way to check if they are well hydrated, if your pet's well hydrated, is to just pinch the skin a little bit. You want to find an area where there's plenty of extra skin and just gently with your finger and thumb pinch the skin and tent it up for a second and then let go. It should immediately spring back into place. This is a good indication that they are well hydrated. If it doesn't and it stays tented up, it may be dehydrated. And then a note on temperature. It is not appropriate for us as groomers, because we are not vets or vet techs, to take a pet's temperature internally, whether that be rectally or otherwise, because that's an invasive procedure. It's not something that we should be doing. However, we can get a general feel for a pet's temperature just by feeling them and paying attention. They typically run a little bit warmer than us. Normal body temperature for dogs is between 100 and 102 degrees. So they are going to feel a little warmer to the touch than us. But if they feel anything beyond that, or, you know, like they're running a fever, you can definitely feel in their tummy area is the easiest place to get a feel for their overall body temperature. And I'll just feel the tummy area. If it feels overly hot or cold, there may be an issue there. And we can at least note that as part of our vital sign assessment. And then a note on inducing vomiting while we're talking about things that are not within our scope of practice. No, we should never, ever, ever induce vomiting in a pet unless specifically told to do so by a veterinarian, not vet staff, not the pet owner. This is only something that we should do if we are told to by a veterinarian in person and not secondhand. Shock management. So shock is defined as a lack of adequate supply of oxygen to the body tissues. Shock can range from mild to severe, including collapse, coma, and even death. There are numerous causes for shock in animals, including injury, poison, infection, exposure to the elements, and it can be a secondary symptom to existing problems or emergencies that the pet is experiencing. So the first part of our protocol is that we're going to restrain and muzzle the pet if needed. We're going to place the pet on its head, on its side with its head extended. This is to make sure that they have access to a nice open airway with the nose extended away from the body and chest. And then if we can, we're going to elevate the back end of the pet a little bit higher and put blankets or towels underneath. Another note for shock is that when a dog is experiencing shock, they're not going to be able to regulate their own body temperature very well. So we need to do that for them, make sure they don't get too hot or cold. So say if you're outdoors, if the pavement's super hot, you want to put something under them, or if they're feeling too cool to the touch in their shock, we're going to cover them with blankets and keep them nice and warm. We're elevating the back end in order to give the heart a little bit of help. If the heart doesn't have to work so hard, it's going to help alleviate some of the symptoms of shock. The other thing that we might do is make sure when we extend the head that the tongue is just pulled free of the back of the throat and not in the way to obstruct any breathing. Do not give the pet anything to eat or drink when they're in shock. And keep a check on capillary refill, which we discussed previously. We're putting pressure on the gum area to see how quickly the blood flows back into that area. Other symptoms can be weak and rapid and shallow breaths. Sometimes we refer to this as thready in the pulse. So it's going to be a very quick pulse, but it's going to feel very weak. So instead of like bum, 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 it's going to be like because the heart is trying to work faster to do its job because it's failing, but it's not going to get a lot done in each beat. So it's going to go very quickly and very shallowly. Okay, let's move into fractures and limb injuries. So multiple injuries to the skeletal system, including bones, joints, ligaments, are common in all types of major accidents and trauma. A dislocation is an injury to the capsule and ligament of the joint and results in displacement of a bone or joint at the joint. A sprain is an injury in a joint, ligament, or muscle. The muscle or tendon in the region around the joint, and a sprain is an injury to the muscle that results from overstretching. Fractures can be caused by motor vehicle accidents, falls, trauma related to recreation, exercise, or even blunt force. There are two types of bone fractures, simple and compound. A simple is when the broken bone does not puncture the skin, and the compound is when the broken bone fraction does come through the skin. You're going to see signs and symptoms of limping, favoring one limb over another, or obvious pain in an extremity or tail. And so our protocol for broken or injured limbs is going to be to first, of course, restrain and muzzle the pet if needed. Special care should be taken when handling a pet with this type of injury. The general rule of thumb is any pet in pain or moved into pain can and will bite. So extra special care in this instance to make sure you're keeping yourself safe and the animals around you safe. In the process of splinting that limb, you may move it and move the pet into pain, and they may retaliate accordingly. The next thing that we're going to do is immobilize the limb as it is found. So meaning we're not going to move it from the position you find it in. You risk damaging more tissue, moving any broken limb or even a strain or muscle pull that way. So however we find the limb is how we're going to do it. We're going to find a hard, straight object. I have in your first aid kits a couple of options size-wise for this. And for this particular dog, we're going to pick the larger one. And if this front leg is the one we're going to immobilize, we're going to put it down the length of the leg, gently set it there, and then we're going to take our gauze and we're going to start at the top above the injury and start wrapping that splint in place. Be careful not to over tighten. You may again move the injured limb by over tightening it, and we don't want to cut off circulation, what little there may be there if there is a broken bone or an injury like that. And we're just going to gently wrap that splint into place. You can even take the extra step of tying off so that it stays in place. And I always, if I have extra on the end of my roll, I'll just tuck it under like that so it stays in place and we're ready to transport. At this point, we're ready to transport to the animal hospital. We're going to try to alleviate movement as much as possible, and we may need to be ready to treat the pet for shock from this injury. All right, our next thing is going to be poisoning. So poisons can be liquid, solid, or gas, and it's anything that can cause harm or death when ingested, inhaled, absorbed, or injected into the pet. Dogs are 4 times more likely to be poisoned due to their curious nature. They really like to investigate everything and stick their faces in places, so they're a lot more likely to be victims of poisoning. Careless handling of and storage of potentially toxic substances can lead to poisoning. This is why we're really big in our salons on labeling all of our cleaning supplies and products that we use really well as keeping them in places where pets can't access them to chew on them or ingest them. Garbage poisoning is a really big one in the United States, and it's something we can see easily if they ate out of the garbage at home and then were immediately dropped off their appointment with us. So be aware that a poisoning could occur before you're in possession of the pet, and watch for the signs and symptoms of that. Staph bacteria is often found in the garbage, and that's going to present with signs of vomiting, diarrhea, excessive salivation, breathing difficulties, excitability, loss of consciousness, and sometimes even seizures. They may also present with an elevated heart rate and breathing at first, but that can quickly decline into too slow heartbeat and breathing, and even unconsciousness and death. So when we encounter these signs and symptoms and suspect poisoning, we want to try to determine the substance of the poisoning if at all possible, and if we can, we're going to take the packaging with us to the vet when we transport the vet to give the vet the best chance to find out what they've been poisoned with to treat accordingly. And it also, if they vomit, take some of the vomit with you to the vet. Poop bag is fine because you can just put your hand in the poop bag, scoop it up, tie it off, take it with you. That way they can test that if need be, especially if you didn't witness what the substance was that they were poisoned with. And then, of course, they're going to contact the vet or an emergency center. For any pre-hospital care, they're going to tell you to do. We're going to go back to earlier I said we do not induce vomiting unless specifically told to do so by a vet, or in this case, animal poison control. And we do have access to the ASPCA Animal Poison Control Hotline if we can't get a hold of a vet. The number is there in your packets and it should be posted in your salons. If we can't get a hold of a vet immediately, that is another option. They do charge with a credit card over the phone, but it's kind of our only resource when we can't reach a vet. And they do as many follow-up calls as necessary. And I've even had them find a vet close to me that's able to take the pet immediately on an emergency basis and set it up for me to just go directly there between me and the vet on another line. And then similar to poisoning, but different, is insect bites and stings. So these incoming are from ants, bees, hornets, wasps, spiders, anything that can bite or sting a pet. Some insects that bite or sting live in colonies, so be prepared for the likelihood of multiple stings or bites. Unless you observe the pet being stung or bit or notice a severe allergic reaction, you may not immediately be aware of why the pet is suffering. So just, if anything's off with the pet, monitor all of their vital signs and monitor them for any decline in their health in the moment. They're usually not life-threatening unless the pet has a severe allergic reaction. We'll talk about anaphylactic shock, which would be that severe allergic reaction next. In the meantime, your protocols for this, first thing you know are signs and symptoms. The pet may be in pain, they may have redness and localized swelling at the site of the bite or sting. They may lick their paws or paw at the area or their face, scratch at it. When my dog got stung by a bee on her lip, she was pawing at it like this, so watch out for those signs. Our protocols are going to be to keep yourself safe, immobilize and confine the pet for observation and reduce their level of activity. If the pet is muzzled, be prepared to loosen or remove the muzzle and keep a very close eye on swelling. Not dog or cat related, but I did have a horse that was bit by a rattlesnake on its face at one point, and its head swelled up to 3 times the size that it normally would be, and we ended up actually having to keep his airway open with cut pieces of hose up both nostrils, but it saved his life and kept his airway open. So the likelihood of swelling is huge, and breathing is going to be a major priority when you encounter any pet having a sting or bite emergency. To keep an eye on and keep open for them. Identify the insect if possible, and you can remove the stinger that's present. If you see a stinger, don't grab it with your fingers or tweezers. Many times, like in the instance with bees, they have the sac where the poison is kept attached to the stinger, and you may inadvertently squeeze more of the venom or poison into the sting site by squeezing it. So I recommend doing a credit card or the hard edge of a piece of card or plastic or a key and sweeping underneath the stinger and trying to flick it up out of there instead of any squeezing on it like that. Treat symptoms as they present themselves. Everyone is different, as we know with ourselves, as far as how we react to different poisons and venoms. So you may see wildly different symptoms between pets and dogs. Just as they present themselves, treat what you can. You can apply over-the-counter antihistamine lotion or calamine cream to the area. Oral antihistamines may be administered only in the direction of a vet. So we're not going to medicate. This is part of our scope of practice that we are not veterinarians and we cannot give medications or diagnose in that way. So only if a vet tells you to do. The special circumstance with bites and stings is going to be anaphylactic shock. This is an extreme reaction or hypersensitivity to a given substance with symptoms appearing virtually immediately. Signs and symptoms for severe anaphylactic shock include extreme swelling at the injury site, difficulty breathing, wheezing or stridor. We talked about what stridor is earlier. You can hear them trying to breathe, and or like if you imagine, if you've ever seen a human have an asthma attack, that strain to breathe in. Yes, Brandon?
Sorry, it was about the poison. I know at Fallbrook we have a dog first aid kit, so I'm just on what's topically okay to put on a swelling for a dog.
Anything that's a topical antihistamine or a cortisone-based itch relief cream. So anything that's going to bring down itchiness and swelling.
For humans that we can put on.
Yeah, as long as it's topical.
Okay, cool.
Yeah. Other signs and symptoms of anaphylactic shock are going to be vomiting, excessive salivation and drooling, restlessness, seizure, or unconsciousness. Death could be intimate because, I'm sorry, my thing didn't print very well here. Rapid respiratory and circulation deterioration can occur. So we talk about the swelling and the airway shutting down. All the cells in the body kind of overreact and freak out in anaphylactic shock, and they start dumping all the fluid in each individual cell. And when cells and blood cells don't carry fluid, they cannot carry the oxygen, the electromagnetic pulse that's in them, and everything starts to sort of quickly cascade into catastrophic results very quickly. And the first things that go are heart rate and breathing. So that's what we're mostly going to be paying attention to and trying to assist the pet in keeping vital is airway. ABCs, airway, breathing, and circulation. Contact vet hospital immediately, follow instructions, and transport immediately to a veterinarian. And similar to that, we're going to talk about snake bites. Here in Southern California, we do have a lot of snakes, and we have rattlesnakes, and they're pretty common even in more urban areas. So it's a common occurrence for dogs to get bit by snakes, also due to their curious nature. I do believe my horse got bit by a rattlesnake on his nose because he was just being curious and put his nose down to smell it and see what it was. So, you will often see snake bites to dogs on their head and face and around the front area for that reason.
Don't they have a? I'm sorry.
Yes.
Don't they have some type of vaccine for dogs now?
They do. I am not personally aware of how effective it
Yeah.
is, but it's something you can research on your own for your own pets.
Yeah.
Yes, Angela?
My mom actually got it done, and her dog ended up getting bit by a rattlesnake, and that shot saved his life.
Oh, it did work in that case, yeah.
Yeah.
It's not something I researched very readily. I spent most of my energy teaching my pets to avoid things like that, so I haven't had it with my dogs. I never really saw it coming with a horse, but you never know. So there are two types of snake bites, obviously, venomous and non-venomous. Any pet bitten or even suspected of being bitten by a snake should be examined and monitored by a vet or hospital for 24 hours minimum. So it's not something we recommend that we just let the pet chill at home and see how they handle it. They do need to see a vet no matter what, and they should be monitored by that vet over time as symptoms may occur on an ongoing basis. Prevention is key. Keeping dogs on leashes. I know we all kind of have a pet peeve about this, that all dogs should be on leashes and restrained well. So we can recommend our clients, of course, that they keep their dogs on leash for their pet safety. Dogs are more often bitten on the head. We've talked about that. And because they're more often bitten in the head and face and the front of the body, they are more likely to have issues with their breathing and their breathing openings. Swelling. Approximately 30% of snake bites are dry bites, or a bite that does not release any venom. So a lot of times snakes are just warning the dog to keep away and not releasing any venom, but we do still encounter the risk of infection and reaction from any open wound like that. If the bite is non-venomous, then basic wound care and antibiotic treatment is warranted. If the bite is venomous, symptoms will be almost immediate. And bite marks are not always visible because the pet's hair and coat may prevent you from being able to see the bite mark. Also, swelling can pretty instantaneously close up and conceal bite marks, so we might not always be able to see them. Initial signs and symptoms when the venom is injected is pain, swelling, bruising, oozing blood around the wound site. The pet may also be nervous or depressed, appear weak, salivate and drool excessively, vomit, and or have convulsions. Our protocols in this instance is to immobilize and reduce the level of activity for the pet immediately. If muzzled, be prepared to loosen or remove the muzzle if breathing problems or facial swelling develops. Remove the pet's collar or harness or any other restricting items that are on them. Having your slip leads ready is a good way to restrain the pet because it slides open and closed, so if swelling begins, it can accommodate the pet more easily with that. Collars and things that are stationary, if the swelling advances, may have to be cut off of them before they have a chance to constrict any breathing or respirations. We're going to treat for shock and keep the pet comfortable and contained and immediately transport to the vet hospital. The best snake bite treatment is a set of car keys. Now get them to the vet immediately. If you can, attempt to identify the snake that bit the pet. Photos, now we all have phones in our pockets, so you can zoom in to take a picture of the snake to let the vet identify what kind of antivenom they may need. Don't get close. Don't try to catch the snake. Don't try to kill the snake. You run the risk of you getting bit as well. Alright, so now we're going to go into some of our temperature emergencies, and we're going to start with heat stroke. So the definition of heat stroke is a high body temperature, 103 to 105 degrees or more, and stress can cause the pet to go into heat stroke. Heat stroke is most often caused by leaving a pet in a confined space with little to no ventilation or water, especially during warm weather or high humidity. The temperature in a closed car on a hot day can reach as high as 150 degrees within 15 minutes. This is pretty common in our area here in Southern California, where the weather is so dry and hot the majority of the year. Heat stroke can also be caused by excessive exercise in warm weather, and as we in the grooming industry know, any of our brachyceptic dogs or brachycardia dogs, where they have the pushed-in faces, so pugs, French bulldogs, regular English bulldogs, any of these breeds, Pekingese, they can suffer from heat stroke much quicker than any of your average dogs as well. So that's something to be aware of and think about. They don't even have to be out in a hot car. They can just have walked too quickly into the grooming salon, and if the kennel or the grooming salon is a little too warm, they can start to suffer symptoms of that. So we always need to be monitoring every pet in our care in the salon and making sure they're at a comfortable temperature and not in distress. Also, another note is that dogs bred for cold climates. Our Huskies, Malamutes, and with the super thick double or triple coats, they have a hard time here in Southern California when it's 110 degrees or more, and to keep an eye on them and their temperature as well and offer water and make sure they're comfortable. So our protocols for heat stroke are going to be to restrain the pet and keep safe, you and the pet. Muzzle only if absolutely necessary. A big way they're going to be trying to cool themselves is through panting and breathing hard, and we don't want to restrict that with them. If they're muzzled, you must cool the pet because it will not be able to pant and cool itself. Bathe or hose the pet with cool water until their temperature subsides. You can also place the pet in a cool, well-ventilated space and wrap it in wet, cold towels. Be aware of the duration of time that you're doing this for. You don't want to take, especially our small breed dogs, from being overheated and then overdo it with water that's too cold or for too prolonged time and take them into a hyperthermic issue where they're too cold. Hypothermic issue. You can, if you have the ear thermometers, superficially you can check their temperature, but again, we don't do any kind of internal temperature checking as it's not in our scope of practice. I believe for dogs, if they're at 105 degrees or more, the brain is literally beginning to overheat and cook, and that's when we often see seizures occur, is 105 degrees or more. So it's really important that we quickly begin to bring their temperature down and then monitor. All right, so burns. A lesion of the tissue due to heat or chemical burn. We often don't think of chemicals when we think of burns. We just think of heat-induced burns, but it can be chemical, electrical, or thermal. Burns can be caused by hot or caustic liquids, electricity, acids, and other caustic materials. Prevention is best in this case. If they're outside of a strange environment, we need to pet-proof our homes and shops and be sure pets don't have access to harmful chemicals or dangerous areas. We have 3 classifications of burns. The first degree burn, skin may be red and painful, need superficial wound care, and we're going to keep the pet from licking the affected area. A second degree burn, this is burned through the outer layer of the skin. This burn may be red and swollen, oozing a yellow or clear plasma, and it may blister. This type of burn runs a high risk of infection, so keeping it very clean is important. And then the third degree burn is a full thickness skin burn, so it's going to go all the way through the layers of skin, and it may appear charred. Sorry, I lost my spot. Parts of the hair and skin may appear charred. Risk of infection is extremely high in this case, so we're going to keep it as clean as possible. Our protocols for our first degree burn are to just cool the burned area with copious amounts of cool water. Depending on the surface area, the burn may heal on its own or may need some care. Watch affected areas to make sure it is healing properly. You do not bandage. And in our case, if it's not our pet and it's our client's pet, you still need to have them transported to see a veterinarian for vet care. Second degree burn, similar, we're going to flush with cool water. This type of burn, we do want a bandage to keep it clean and mitigate our risk of infection. And we're going to transport to the vet. Third degree burn, as the risk of infection is so high, we definitely need to get that dog immediately to a veterinarian for supportive care. Cover the wound with dry dressing, prepare pet and transport. We also want to be prepared to treat this pet for shock. Chemical burns, we're going to flush the area with cold water to remove any excess chemicals, determine the type of chemical. Pet may need additional treatment depending on the chemical. Baking soda can be used to neutralize burns caused by acid, and we're going to determine the severity or degree of the burn and treat accordingly and transport to the vet. Electrical burns, treat for basic life support, so airway, breathing, circulation, or ABCs, and transport to the vet immediately as well. So we'll hop into some of our cold injuries. I'm going to start with frostbite. Frostbite is freezing of the skin and tissue due to prolonged or extreme exposure to low temperatures. The areas most affected are ears, paws, scrotum, and tail. Does anyone guess why those might be the areas that are affected first?
They're the
Extremities.
Yeah,
Their extremities?
that hang off more.
Yeah, so they're further away from the heart. They're not connected to the body, so they get a little bit less circulation and blood flow, which would keep them warm and protect them from frostbite. So that's why they're some of the first areas. Skin can become swollen, red, and painful. It can also be hard and pale or even black. In later stages, the pet may lose skin and hair in the infected area. The lesion or affected area may look similar to a burn. In the late stages of the frostbite, the skin will look hard. So basically what's happened is that tissue and skin has frozen and it has died. It is dead. It's not getting circulation anymore, no blood flow to it, it's dead. So it's like sometimes we see the sloughing off of skin and hair in those spots because it's just dead and it's coming right off. With a frostbite injury, we're going to need immediate veterinary interaction. Just warming this pet up isn't enough because we do have dead tissue there. So now we essentially have a wound as well that's going to need to be treated by a vet for infection. So we're going to transport to the hospital, try to prevent any further pain, ward off infection, and obviously we are going to also try to make sure the pet's warm overall. Specifically, just frostbite is the localized area of frost or a cold injury, and next we're going to talk about frostbite, which is, or I'm sorry, we're going to talk about hypothermia, which is overall cold. All right, so hypothermia is a dangerous condition that occurs when the core body temperature drops too low. Mild hypothermia begins for dogs when their body temperature drops below 99 degrees or 100 degrees for cats. So earlier we were talking about vital signs. We talked about the normal range of temperature for dogs and cats. And so we know cats run a little bit hotter than dogs. So anything below 100 for them or 99 for us. They're still going to feel warmer than our body temperature. What's the average human body temperature? That's
98.6.
98.6. So this dog may feel warmer to the touch to me, but it's colder than they're supposed to be, and especially even if it's only at 99 degrees over a prolonged period of time, they could start to move into hypothermia and be too cold. While most dogs only experience hypothermia in cold temperatures, puppies, kittens, seniors, and toy breeds, as well as any dog suffering from
Hypothermia.
well, yeah, they'll feel hypothermia. What is the autoimmune disease? Thyroid disease. Pets with thyroid disease often also they're too cold too often. They have a hard time regulating their body temperature and keeping it high. So all of these pets are way more prone to hypothermia and being too cold. So damp and wet pets are extremely vulnerable to hypothermia. We're going to see signs of shivering, curling up for warmth, shallow breathing, low blood pressure or low heart rate, lethargy, and tiredness. Increased heart rate at first may occur because the body's trying to heat itself up and it's going to bump that heart rate up really high, and then you very quickly see the heart rate start to go below normal and become too low because it can't keep that up. Sluggish and delayed reflexes, pale skin and gums, and cool to the touch, especially in the ears and extremities. They may have dilated pupils, and eventually we'll see a loss of consciousness. Our protocol to treat this, mild hypothermia can be treated with insulation and blankets, giving them just a place where they can be warm other than their own skin. Moderate hypothermia will require active external heat source such as radiant heater, along with the insulation of blankets and towels. And severe hypothermia requires invasive core warming, which must be done by a vet and involves IV fluids. All right, so seizures and convulsions. This is defined as the involuntary contraction of the muscles caused by abnormal cerebral stimulation or dysfunction. So the brain is not operating properly, and that's when we see the seizures occur. Seizures and convulsions can be caused by epilepsy, poisoning from a toxic substance, even small amounts of poison over time, like lead exposure, and head trauma. And then most commonly, head trauma seizures are caused by being hit by a car, a fall, or some major trauma like that. A seizure caused by poisoning is an emergency situation, and the vet needs to know the amount and type of the poison ingested, which we went over in poisoning. Pets may have a seizure due to stress and overstimulation, such as while being blow dried. So we all see that every once in a great while a barking seizure for a pet that's being blow dried. They've just become way too overwhelmed, and their stress level is not mitigated by them, and their brain cannot function normally due to that level of stress, and we'll see mild seizures that way. Signs are going to be falling, chomping and biting at paws, stiffening of the body, paddling motion of the legs, like the swimming in the air, jerky and uncontrollable movement lasting 2 to 3 minutes. We'll often see this indicated with the dog barking, and it is like a steady, uncontrollable bark that just goes on and on and on, and they almost look like they're not home, and they're just bark, 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 bark. You know, they're not in control of that situation. That is a mild seizure. And then, any uncontrollable movement lasting more than 2 to 3 minutes. Uncontrollable barking or screaming, accompanied by urination and or defecation, Prior to and after the seizure, the pet can have a low level of consciousness, be unresponsive, or not know who you are, or become irrationally aggressive. Also, their entire body, every muscle in their body has just been involved in the seizure and has convulsed very, very extremely for these periods of time. They are often exhausted after. It's usually sometimes not a good idea to continue this groom, even if it's something that the pet parent knows about and you know about, and it's a common occurrence for a small seizure. If this dog's too tired, we don't need to push. They're exhausted afterwards, as you can imagine. The other thing to be super aware of is the aggressive thing. When they come out of a seizure, they often have no idea who they are, where they are, who you are, and what's going on. It was like a year ago, had a small dog have a seizure. It lasted longer than I was comfortable with. I wrapped him up in a towel and started walking him across the street to the vet. And when I got halfway across the road, he came out of it completely and was lunging for my face, trying to bite me while I had him wrapped. Luckily, I had a towel and a lead on him, so I was able to contain him safely and keep myself safe. But it went from a dog I had groomed for years, who's my best buddy and best friend and super sweet and loving. He had no idea what he was doing, was not in control of it, and he would have latched onto my face if given the opportunity, because he just wasn't home in that moment. So always beware keeping yourself safe and others and the dog. And even though he was completely out of it when I started to leave for the vet, I still had a lead on him and a towel and was prepared to restrain him if necessary, and luckily I did. So our protocol for this is to stay calm. It's often a very ugly emergency to witness, and it's upsetting. So take a breath, stay calm. We're going to reduce all external stimulation. So if you're not able in that moment to shut off the light, shut down, I will often wrap a towel around the dog and walk into the bathroom and sit down, whether it's on the toilet or the floor or wherever I can go, to a dark, quiet room and just have sound and light levels gone. And I will just sit quiet. I don't try to pet them. I don't say, are you okay? Are you okay? Just sit quiet and let them come out of it on their own in their own time with no outside stimulation. We often get really used to the noise levels in the shop, the light, situation in the shop, the dogs barking, the sights and sounds, and all the stimulation can be a lot for dogs that only come once a month or less. So we're going to mitigate all stimulation, give them a chance to come out of it. Do not restrain the pet or place anything in its mouth. We're not going to muzzle it when it's having a seizure. All we're looking to do is to keep it safe while it's having the seizure. You can't stop a seizure midway. You have to let them go through it and come out the other side. So we're going to keep them safe while that's happening, because they're not in control. They can, move across a room if left unattended. So we're just going to, at least enough to keep them from bouncing across the floor, running into a wall. Sometimes I put blankets under a large dog's head so that it's cushioned if it's bouncing a little bit and they're not hitting the floor. We're just going to gently contain and keep them safe while it's happening. Get rid of external stimulation. Clear the area of hard or sharp objects that might cause harm. If possible, pull the pet away from any objects that might cause harm and onto a blanket. As we talked about, you can loosely wrap them in a towel and hold them gently to protect them. When a seizure stops, start monitoring breathing. Go back to checking your ABCs, airway, breathing, circulation. Keep the pet comfortable in a quiet, dark place, and then give them a break. Give them 15 minutes minimum before you go back to reassess, what you should do next. If the pet has no history of seizures, it should be examined by a vet or animal hospital. Always stop the service, inform your manager, and wait for instructions before continuing. Note the duration and frequency of the seizure. One thing that's not listed in here is the definition of a grand mal seizure is that the seizure itself lasts more than, 1 minute, and it's more than twice in a row. So if it's one off, it's a little bit better, but if it continues or each seizure is for an extended period of time, it's definitely not good, and we need to transport immediately to the vet. So as pet professionals, we need to observe and assess the pets in our care constantly with a clinical eye. Other health indicators to watch for are physical stance. Does the dog Does the pet look or hold themselves as they sit, walk, and stand? Is it off from normal as they usually are? Are they favoring one side, won't put weight on a certain leg? If a dog has always been well behaved for a portion of its grooming service but suddenly becomes super uncooperative, maybe it's in discomfort, maybe it's hurt, maybe it's having a health emergency. Be observant and aware. We are often the advocating voice for the animals in our care. And the other last thing to pay attention to is skin and coat. That's the thing we specifically deal with and look at constantly, and we can see changes in. One of the first areas that an animal will start to show signs of distress, malnutrition, other underlying issues is on the skin and coat. Note any drastic changes in the pet's health, skin or coat, and inform the owner and recommend they see their vet. All right, so we're going to go through choking emergencies for our pets. And so choking is just insufficient exchange of air caused by a foreign body or object in the pet's airway. A couple notes here. Dogs are 3 times more likely to choke than cats, although cats do like to eat foreign objects sometimes a lot, like hair ties and things. Excuse me. If an obstruction is cleared, it is recommended that the pet still see a veterinarian for any potential injury to the airway. Save the object that was obstructing the airway or they were choking on and take it to the vet. Signs and symptoms for pets choking may include violently pawing at their face, gasping and gulping for air, frothing or foaming at the mouth, difficulty breathing and stridor-like sounds or high-pitched wheezing sounds, and a lot of agitation and anxiety. Our protocol for pets choking are going to be divided into 2 groups. One is going to be conscious and one is unconscious. So if we find a conscious pet and it has a heartbeat and it's awake and it's choking, if the pet can cough or gag at all, they are going to have a much better chance of dislodging that foreign object than we are. So it's recommended that we put the pet in a smaller area and confine them for observation. If we have a large breed dog, maybe don't put them in a smaller kennel. We want them to still have the ability to stand and sit and walk around a little bit. And we're going to observe them the whole time. We're not going to take our eyes off of them, and we're going to give it several minutes. So I would say 10 minutes or less, and give them the opportunity to try to cough or gag that object out of the airway. If the object does not come out, we're going to obviously transport to the vet immediately, and we're going to keep an eye on the dog and treat it. Be prepared for it to go unconscious if the airway becomes more obstructive while we're transporting. If the conscious pet cannot gag or cough or has stridor, the high-pitched breathing, then we're going to perform chest thrusts in order to try to dislodge the item. So similar to the Heimlich maneuver, only it's a little bit different for pets. So we're going to use our good boy Fred here, and in many cases we can just take our hands on either side of the dog's chest area, right behind the front leg, the shoulder area, and we're going to press in with both hands in a pretty firm, rapid motion. You want to push in the direction you want the item to go. So if it's out the front, out of the mouth, kind of like bellows for a fireplace, we're going to push forward and in at the same time. We're going to perform the chest thrust until the object comes up or the pet goes down. So we're going to do these chest thrusts until we either get the object dislodged or the pet becomes unconscious. Thrust in the direction you want the item to go after several attempts. You're going to take the pet to the veterinarian after about 10 minutes of doing chest thrusts, or if the pet becomes unconscious. Now, if the pet becomes unconscious, they're going to be on their side. And in this case, we're going to move to chest compressions. The compressions of the chest are going to act as chest thrusts in this case. Another note is if you have a very large dog and you have them on the floor, you can stand on either side of them to do the thrust. And then in some cases, like when we have Great Danes or something, you may not have the physical size or strength to do chest thrusts while they're standing. You may try to lay them down and do the chest compressions anyway to try to get that out. If we go to chest compressions from the unconscious dog, we're gonna do 30 chest compressions right off the bat. So we're gonna go into detail on chest compressions when we do the CPR section, and everyone's gonna practice it. But in short, we're gonna take one hand, the thumb is facing the dog's head, and we're gonna slide it in right behind the armpit or the elbow, and then place our other hand directly on top of that and do our chest compression straight down. As we'll go into further detail when we do CPR compressions, you want to be compressing the chest 2/3 of the way or halfway down. So it's a good deep compression. We want to really squeeze the rib cage together to squeeze that air out in a rapid motion and try to dislodge the object out of the pet's mouth. After you perform 30 chest thrusts, we're going to check the pet's mouth. We're going to tilt the head back to open up the airway in the throat. And we're going to open up the pet's mouth and use our fingers to pull the tongue out past the canines, or the two big teeth in the front of the mouth. And we're going to pull the tongue out of the way and kind of hold it down. We're going to turn the pet's face towards us so that we can get a good view into the pet's mouth. We're going to look down there and we're going to look and see if we can see that object that's lodged in there. If we can see it and we see any debris, food, the foreign object, or anything that's in there, we're going to try to reach in and pull it out with our fingers. You can also do tweezers or pliers if necessary. Do this in a safe way. Be prepared for, if you do get it out, that the dog's going to immediately jump up or react physically. But I typically will go with just 2 fingers trying to scoop out. Try to get my fingers behind the object or debris that's in there and scoop it out to clear the airway. If you clear the airway or you can't see anything there, then we're going to go into giving the pet a breath to see if we can get air in and if we have an unobstructed airway or not. So we're going to place our hands firmly around the pet's muzzle and compress the mouth together. The tongue should still be forward, out past the canines and out of the way. We're going to compress the mouth together to tightly seal so air can't escape the sides. And we're going to give 1 breath over the course of 1 second to see and watch if we have rise in the chest. If the chest rises when we give this breath, it means we do have an open airway now. So that's going to look like we'll have this mouth shut. We're going to give a breath, and when we give that breath, we're turning our head towards the back of the dog and watching for the chest to rise and fall to see if we have an open airway now or not. Please be aware for little animals, cats and small dogs, to not overventilate. Often in this situation, we're keyed up really hard, our adrenaline's pumping, it's an emergency situation, we have a tendency to want to blow really hard. You can overventilate and overexpand the lungs on a little dog. So just be conscious of that when you're doing this. If the breaths go in, you have now established the airway, and now you're going to check for pulse and make sure they have a good strong pulse. If there is no pulse, we'll move into CPR at this point. We're going to do 2 breaths in total. So the first one, we're going to watch and see if the air goes in. If it does, great. We're going to give a second breath and establish that airway really well. If our breath does not go in, we're going to reposition the head, make sure the tongue's out, try for a second breath. If the second breath also does not go in, we're going to go back to our chest compressions and continue to attempt to do those compressions until we dislodge the item further. We do this a couple of times because maybe the first time those compressions weren't enough to pull it up to where we could see it and remove it, but the second round it may push it up further to be able to reach in and remove it. Each time that we stop compressions to give breath, we're going to reopen the dog's mouth and look and see if we can see the object stuck in the mouth or throat. After several minutes and you have not removed the obstruction or established an airway, you need to transport the pet to the nearest animal hospital. So I would go with the same count for CPR here in this instance, where we do 30 compressions, 2 breaths, and we do that 2 times in a row. If you still don't have an airway, we're now getting into about 1.5 to 2 minute section. That's when we need to transport immediately because this dog has no airway. We don't have our ABCs. They're not going to survive very long without breathing. Some of our bulldogs, they're so barrel chested, you sometimes physically cannot get a good chest compression or chest thrust. In that case, you're going to want to roll the dog over with a helper so that they're on their back and their belly is facing you. And similar to human Heimlich maneuver, you're going to do a thrust up into the belly towards the front of the dog this way. That's if you cannot get a good chest compression while they're laying on their side because their ribs are so sprung out round. Yes, Angela?
What is the chances of breaking your ribs when you're doing that?
High. If you're doing chest compressions properly, you are very likely to break a rib. But that pet will survive broken ribs. They will not survive not being able to breathe. Okay. So it's worth the risk. And you may feel it. It's going to be awful feeling and it's going to be shocking, like startling. Just remember, it's normal. It's okay to break ribs. You know, it's better to establish that airway or get that heart beating again.
Okay.
And then another small note, we don't see a lot of catastrophic physical pet emergencies like when an animal is hit by a car in our salons, but it is always possible. A dog may be hit by a car in the parking lot or any number of situations. You're going to be hit with a lot of different symptoms and issues at one time. Keep your head. Think about airway, breathing, circulation. The very first things that you're checking out is ABCs. While a dog's broken leg and huge gash bleeding on the side are very shocking and demand your attention, they are not going to die of a broken leg or a gash in the next 2 hours, but they can easily die without airway, breathing, or circulation. So that is your first priority. You can leave a wound to bleed a little, you can leave a broken leg. Focus on airway, breathing, and circulation first and maintain your priorities, especially when things are chaotic. Another note too, if incidents happen outside of the salon, you may have a lot of people in the vicinity that are reacting and overreacting, and things can become hysteric and dramatic very quickly. Always look around, find the first person who looks the calmest, and grab them and pull them into being your assistant and help them. Even if it's just, can you help me with crowd control? Keep these cars and people back. Find someone else that can help me do compressions. You know, ask for help and have them push people back. I've had incidences where I've had the owner screaming literally in my ear and hitting me while I'm doing CPR on their pet. They were not mad at me, but it was just a strange reaction that they had in their, emergency, that they were witnessing their dog in this state, and they didn't know what else to do with themselves, and that was what was happening. I was able to ignore it long enough to continue CPR, and then finally saw someone who was a little bit more level-headed and said, can you please help me and get her, and I said, get her off of me, but calm her down in the corner, and then was able to continue working on the pet. And that kind of brings us into our next section of this, which is the first thing you should do even before assessing the pet and your ABCs, and that is your scene safety. So if you're driving home from work and you witness a dog be hit by a car, your initial instinct is going to be to run to that dog and do what you can to help them. But if you're not paying attention to your scene safety, you may put yourself in danger or at risk. We saw this a lot with hurricane issues where people jumped out to help other people and animals and weren't paying attention to the original emergency was a down power line. And so bystanders trying to help were being electrocuted from the same power line the initial victim was hit by. And then emergency workers had multiple victims to treat in that case because people just weren't looking around at the surrounding and their scene safety and taking note of that. So for environment and scene safety, we're going to remember the acronym PETAID, P-E-T-A-I-D. And these stand for P is protect the pet, people, and yourself. E is environment. T is traffic. A is agencies and associations. I is injury or threat of life. And D is disease. So let's start with P, protect the pet and people. Always, if you need to, restrain and muzzle the pet for safety, so neither you, the rescuer, the patient, or bystanders is hurt or injured in the process of rendering assistance. Remember the motto, any pet in pain or moved into pain can and will bite. And we do know to keep in mind that we never want to muzzle a pet when they're vomiting, choking, convulsing, or having breathing problems, but we can restrain them. One of the easiest ways is to take a sweatshirt or a blanket or a towel and wrap around so that we can keep them from biting us but maintain free flow of airway and breathing. Environment, we're going to watch for life-threatening dangers to the pets that exist in urban, rural, and natural, and even groom shop settings. As a pet professional, you should be aware of the inherent dangers which environment presents to pets and humans. Take a moment to assess the scene for any dangers. So if you walk into the salon and you see a dog unconscious in the middle of the floor, take a breath. I always say this over and over again. If you walk away from here not remembering another thing, it's before you react, take a breath. Look around at the scene. Why is this pet unconscious in the middle of the floor? It could have had a heart attack and just laid down. It also could have been shocked. There could be a chemical in the air that made it go unconscious that you are now about to start breathing. So take a breath, be aware of your surroundings, look around, make sure it's a safe environment for you to react. Traffic is another big one. Common cause of preventable injuries to pets and humans is motor vehicle accidents. If you are outside near a roadway during an emergency, be very cautious of traffic. You may employ a bystander or coworker to assist you with traffic while you help the injured pet. If you are transporting the pet, you also need to properly secure the pet inside your vehicle to avoid injury or interference with the driver. I have heard stories of people putting a pet they found on the side of the road in their car to take to the vet, and the pet got freaked out and then started bouncing around the inside of their car and interfering with their driving and not being safe. So also, if you're crouched down on the ground with a pet on the side of the road, drivers may not see you down there. Have somebody help you with traffic control. Think about your environment. Your safety is number one. I know we all love all pets, especially the ones in our care, but your safety comes before theirs. So keep yourself safe before you jump in to help them. Make sure that you're not going to become another victim for emergency personnel. Agencies and associations. In any situation, you must yield control and decisions to authorities, such as police, EMS workers, veterinarians, and even county animal control. If a pet becomes unusually aggressive, immediately contain the pet and control the situation to avoid injury to yourself, other people, and other pets. Local animal control, humane societies, and rescue organizations should be considered as resources. So you've received this training here, and you're going to feel very confident, hopefully, in helping a pet, but don't let that confidence carry over into, telling police what to do or anybody else in the scene that's above you in the protocol ranking. Make sure you listen to local authorities and EMS workers and kind of deliver control and decision making over to them if necessary. Injury and life. There is only so much that can be done in an emergency setting. It is important to ascertain if this is a situation you can help with at the scene, or if it may be best to immediately transport to a veterinary hospital. Life-threatening injuries like no heartbeat, no breathing, persistent and uncontrollable bleeding, broken bones, puncture wounds to the abdomen or chest, unproductive vomiting, severe diarrhea, or loss of consciousness are things that you cannot treat in an emergency setting or on scene. They must be treated by a vet. So just take a beat to ascertain if this is something you can help with in the moment, or if you need to just immediately transport that pet to the vet. And then disease. Pets are mammals, as are we, and they carry many types of diseases transmittable to humans. These are called zoonosis or zoonotic diseases. Diseases can be contacted from body fluids such as blood, saliva, and excrement, or transmitted through open wounds such as bites and scratches. Use personal protective equipment, control the pet, and use sanitation procedures, and be cautious. Okay, so we're gonna jump into CPR for pets. The main focus of CPR is our ABCs, airway, breathing, and circulation. As mentioned before, CPR is just manually doing what the body should be doing on its own as far as breathing and circulating the oxygenated air through the body. So when we come across any pet emergency, there are only 3 situations that we're going to face. Either the pet has a heartbeat and is breathing. In this case, your pet is in need of first aid. If the pet has a heartbeat but is not breathing, this pet is in need of rescue breathing. And if the pet has no heartbeat and is also not breathing, this pet is in need of full CPR. So to determine which situation you are facing, we're going to perform the primary pet assessment. So this is different from the snout to tail assessment. It should be done in less than 12 seconds in order to determine if this pet has the ABCs, or airway, breathing, and circulation. As mentioned before we start any emergency protocols, we're going to check our scene safety, make sure that we're safe and the pet's safe, restrain or muzzle the pet if necessary. And the first thing we're going to assess is the pet's responsiveness. So if he's breathing, he's going to be moving, growling. You'll see the breaths. And when we approach, say we have an unconscious pet on the floor, try to get their attention. We have many old dogs. I know I personally had a dog that was super old and could not hear anymore and could barely see. And it would take me coming up and touching her before she'd realize anyone was even in the room with her. So if you have a pet unconscious on the floor, clap, stomp your foot so they feel the vibration on the ground. You can always say, hey pet, are you okay? Really loudly and forcefully. See if you can get their attention before you assume that they're unconscious. They may just be very deaf or blind or super old or sleeping very deeply. So if the pet's moving, growling, making noise, breathing, this pet is in situation 1 and they are in need of first aid. Safely control and restrain the pet. At this point, you can do a nose to tail assessment to find any injury or signs and symptoms of other issues and administer first aid as needed. Make your managers and others in the vicinity aware of the situation so that they can contact the veterinarian and the pet parents. If you find a pet unresponsive, unconscious, the first thing we're going to do is check for pulse. So we're going to kneel behind the pet. We're going to take our hand closest to the tail and place it on the chest, just behind the elbow or the top of the front leg. And note if you feel a heartbeat with your hand on the chest here. We're also going to open up the airway. So again, we're going to gently tilt the head back and extend the throat to open up that airway. And we're going to look, listen, and feel. So we've got one hand here on the muzzle, one here on the chest. We're going to look, listen, and feel for breathing and try to see if that pet's breathing. We may feel a pulse in the chest. We may feel the rise and fall of the chest when the pet's bringing a breath in. Or we may even feel or hear the breath here at the nose. You can even put your hand gently in front of the mouth and see if you feel any breath coming in or out. If you do not see, hear, or feel anything, this pet is unresponsive and is not breathing and is in situation 2. This pet will require rescue breathing, but before we're going to move on to assess if the pet has a heartbeat immediately. To check for the pulse, we're going to slide our hand closest to the head, down the length of the belly to the groin area where we learned earlier to check for a pulse on the pet. So we're going to slide our 2 fingers, 1 finger, or even the flat of our hand into the crease between the groin and the back leg and feel for a pulse right in there.
Is that the same spot for all mammals? Like animal mammals?
Yeah, the femoral artery for all mammals is the largest artery in the body, except for maybe the aorta, but it's so internal you can't feel it. So it is the easiest place, the biggest artery to be able to feel for a pulse. You're going to use your fingertips to feel for a pulse for a few seconds. And it does say there the largest artery is the femoral artery, and it's the closest to the surface as well, so it's your best chance to feel for a pulse. If you cannot feel for a pulse, this pet is not breathing and has no heartbeat and is in situation 3 in need of full CPR. So to see that all the way through once, this pet I find unresponsive on the floor, I'm going to approach from behind, I'm going to stomp my foot on the ground so they feel the vibrations. Hey pet, are you okay? I get no response. I'm going to come up, put one hand on the chest to feel if I feel any breathing or rise and fall of the chest or heartbeat. I'm going to check here, I'm going to look, listen, and feel. See if I have breathing. It's not there. Slide my right hand into the groin and feel for a pulse. I don't have a pulse. So our primary pet assessment can be done literally in 3 seconds or less, or 3 to 5 seconds. And I'm just going to ascertain ABCs, airway, breathing, circulation. So we're going to go back to page 16 and, I'm sorry, not back. Page 2. So in this situation, we're going to start CPR immediately, and we're going to start with 30 chest compressions and 2 breaths for 2 minutes, and then recheck for a pulse. So again, to do our chest compressions, we're going to take our hand with closest to the back end of the dog, so our thumb is facing the dog's head, and we're going to place it right behind the elbow on the chest, and we're going to place our other hand on top of it. You're going to be more vertical if you can so that your chest compressions go straight down and you're not rolling or pushing the dog forward with your compression, and we're coming straight down. We want to compress the chest cavity 1/3 to half of the depth of the chest capacity so that we're getting a good deep thrust, and these should be done at 100 compressions per minute. 6, 7, 8, 9, 10, and so on to 30. So we're going to start right into your chest compressions. We're going to do 30 chest compressions. We're going to extend the airway open, pull our tongue out past the canines to make sure it's not obstructing the airway. And we're going to do 2 rescue breaths. So we're going to close our hands over the muzzle nice and tight to create an air seal, so the only opening is here at the front of the mouth and the nose. And we're going to secure our mouth over the pet's nose or the lips area if the nose is obstructed. We're going to put in 2 rescue breaths. That breath should be a medium strength and should last at least a second or 2. Keep in mind our small toy breeds and cats and little dogs not over breathe and overinflate the lungs. And when we give the breath, we're going to be looking back at the chest to see if we get chest rise and fall to make sure that our breath is going in properly. So that's going to look like, okay, 2 breaths, back to the chest compressions, 30 and 2, 30 and 2. For how long? 2 minutes. For 2 minutes. We're going to do that for 2 minutes, and then we're going to recheck for pulse and breathing, PR. The goal is to start CPR within 12 seconds of finding this pet unconscious. CPR or cardiopulmonary resuscitation is the act of externally compressing the heart to facilitate circulatory function and mechanically inflating the lungs to mimic respiratory functions. So we went through and do that. Typically we're going to do side to side compressions. Again, if we have barrel chested dogs that are, their rib cage is very wide and it's difficult to get a good deep compression, we can turn them onto their back. You may need assistance for this, and we can do chest compressions this way in order to get that full compression in on the chest. And then for tiny dogs and kittens, I don't have an example here, but you can actually just hold them in your hand and we call it taco compressions, or if they're on the ground, you can do it this way as well. And that way you can gently do it without damaging anything inside or over compressing, and you can do your compressions that way. And do we have any other notes on there? And then to run through the rescue breathing information. Rescue breathing is the act of mechanically inflating the lungs to mimic the respiratory function. If the pet is unresponsive but has a heartbeat, provide rescue breathing. After 2 minutes or you have to move into CPR, reassess to see if that pet has begun breathing on its own and has gained a heartbeat. Extend the head, dependent airway. We went through that, and then remember the main point of CPR and rescue breathing is to replace normal breathing and heart function when these functions fail, to keep oxygen in the circulatory system and moving throughout the body. Keeping vital organs such as the brain oxygenated is imperative until the pet can be transported to emergency medical personnel who can perform life-saving care. Remember your ABCs: airway, breathing, circulation. These basic functions are our first priority, and life cannot exist without them. Some situations, such as the pet being in an automobile accident, may present with a pet with many injuries and symptoms. Do not be distracted and keep your ABCs the first priority. While broken bone or large gash may appear pressing, a pet can survive a broken bone for far longer than it can not breathing.